Hello friends, welcome back to my channel. Myself Monica, and today we are back with this video where I'll be teaching you the applied aspects of the teeth, the clinical anatomy, like what kind of diseases it occur. Diseases not, but problems that actually that occurs in the teeth by birth or sometime due to external factors. So we have this oral cavity in anatomy in GIT where we study about teeth. Okay, but we tend to just study about it, microscopic structure of adult tooth, and we go for its, structure anatomy. We go for dental formula, where do we really go for the this applied anatomy, where we have to learn that what are the problems that occur there. Okay, so during your standard exams and any other examination, these things are really important because you will be asked this. Okay, everyone now knows what the number of teeth in adult tooth, adult person, and what is the number of teeth in the children. You know that 20 and 32. So today, first of all, let's go with this applied anatomy. Let's just first understand what are the problems that occurs in teeth. Then please go to your book and you will find number very nice explanation on your structure and microscopic structure of the adult tooth. Okay, so first of all, there is Hutchinson's teeth. Okay, Hutchinson's teeth. I'm sorry if my pronunciation is wrong. So it is widely spaced, centrally notched, peg-shaped upper central incisure seen in congenital syphilis. So this is important, right? You have studied, this is something you have to insert while you are studying. This is something you should learn definitely, when you go to study. So this means that your incisures, okay, they are widely spaced. Means suppose a normal incisor is like this is widely spaced. Okay, and the second thing is centrally they are notched like this, peg shaped tooth. You can see in people who have got congenital syphilis. So if you see a child, okay, and if you see that they have these kinds of teeth which are widely spaced, centrally notched, peg shaped, usually called as Dracula teeth also. So that is due to congenital syphilis. And the picture for the Hutchinson's teeth I will insert here. You can see it and you can learn it. Okay, you can see here, this is the Hutchinson teeth which I am trying to explain you. So you can see there is a large gap between the two incisors, and also there is this notch centrally. It looks like the Dracula teeth. Okay, so this is known as the Hutchinson's teeth. Okay, which is due to the congenital syphilis. I hope you can see here the way this child teeth looks like, especially in the central incisors. So this is known as the Hutchinson's teeth. This is another picture that I have of Hutchinson's teeth. You can see that it's so prominent here. It just looks like the teeth of the Dracula. So this is the Hutchinson's teeth. Now the next teeth is the natural teeth. So sometime sometime the children, the child is born with teeth, with one or two teeth, okay, by birth. So that is known as natural teeth. They are weak from the roots. They may come out easily after birth. So this is known as natural teeth. So that's erupted by the time of the birth. The next one is the tetracyclines. Okay, so tetracyclines, you must have been very familiar with tetracyclines in all this year in pharmacology. There are so many things that we learn about tetracyclines. So one of the common indication or one of the common side effect of tetracycline that you can add is it should not be given to children who are less than 8 years old. So we have studied about tetracycline. So to the children who are less than 8 years old, so for them we should not give tetracyclines because it causes discoloration of the teeth. So what happens actually is that, okay, if the teeth, okay, when are exposed to the tetracyclines at the time of tooth mineralization or calcification, okay, but the tetracycline will bind to calcium ions in the teeth. Okay, and if this happens, okay, prior to the eruption of teeth through the gingivae it will cause an initial fluorescent yellow discoloration. Okay, so when there is terminalization going on, when there is calcification going on, which usually occurs when less than 8 years of old, 8 years of age, so that time, if the children they consume tetracyclines, or if they through the, if the milk, if they get the tetracycline in the body, then what happens is that the tetracyclines binds with the calcium, okay, present in our teeth, and through it causes the fluorescent color discoloration of the teeth. So it is really important. You just got to understand about its use in pharmacology also. So tetracycline. The next one is the apical abscess, infection of the apex of the root causing the abscess. So sometimes the apex of the root might get infected, which results in the abscess, okay, which I can show you in the picture. Please go through it. So I'm not explaining into depth, but yes, the things that you should know, I'm definitely trying my best to explain it. So this kind of this bulging you can see here, there is the abscess formation in the teeth. So it is usually due to bacterial infections or any kinds of other tooth problems. It can be mild to very chronic, okay. So this should be taken care of. So there is a pus due to infection in the root of the teeth due to different and various factors. Dental caries. So I have already been asked about this question and I made a mistake. So my question was, what mineral deficiency causes the dental caries? So you should know that dental caries is caused by the deficiency of fluorine. Okay, deficiency of fluorine, not just by the definition of fluorine, but also if your teeth are not properly brushed, if you are having too much of acidic thing, and then after you are not taking care of your teeth, then obviously there might be dental caries in your mouth. So that is also known as decalcification of enamel and dentine. So this is really important. You should know about dental caries. So improper and unhygienic food habits and many things also can lead to the dental caries. I think all of us, we know dental caries by the name दांत में कीड़ा पड़ना or दांत में कीड़ा पर्नु. So we get a lots of big advertisements of different toothbrush brands where they tell that having junk food can lead to dental caries. So this is about it. You can see here there is the caries formation in the teeth. Now the next one is the pyorrhea alveolaris, that is chronic periodontitis. So this is known as the when the chronic okay, so when a little amount of infection is there, then it's known as apical abscess. But if there is chronic pus discharge from the margins of the gums, it's very chronic, it's very large amount, and it is known as the pyorrhea alveolaris. So it is also a condition, when you are not taking care of the teeth, you smoke a lot, and there are other many teeth problems, and you suffer with it. So here I don't think I need to explain it. So picture is clearly telling you every information that you require here. There is plaque formation, there is gingival inflammations, periodontal attachment. So it's a very chronic form from where all gums are being infected. So the picture explains you everything that you need to know about it. And the seventh one is this vitamin C. We all know what causes vitamin C. It's scurvy, which is known as swollen gums, and it becomes spongy and it bleeds on touch. Yes, definitely, it's a very common problem. And the vitamin that's required is vitamin C deficiency. So this is also something you should definitely know, and I think most of the people know about it. Then so here you can see that this child gums, they are bleeding. We might also have gone through this where there has been bleeding from our gums. It is usually due to vitamin C deficiency that our gums becomes weak and skin starts getting weaker and starts to bleed. So you can see how the gums are swollen in each tooth, that the gums are swollen here. So that is also the reason of deficiency of vitamin C. It's a very common problem, but it can become a very big issue also. So we need to take care of our nutrition, especially consume vitamin C time to time. Rickets, that is deficiency in the enamel. Next one is so here I can show rickets, that is deficiency in the enamel. Know that rickets is caused due to the deficiency of the vitamin D, calcium or phosphate. So during that, it causes the weakening and softening of the bones of the entire body. Talking about the dental manifestations, rickets includes enamel hypoplasia and delayed tooth eruption, and also deficiency of enamel. So we know that even vitamin D is important for our healthy teeth. So this was all about the clinical anatomy on the teeth. So I hoped that you liked my video. If so, then please do like, share and subscribe to my channel. I'm if you want, then I can even explain the microscopic structure of the adult tooth. But I think that if you want to really go for any standard exams, these are even more important than that you can understand with the books. It's very easy, but these are something with which students tend to miss to learn during the preparation time. So I'm just reminding you to do not forget this part about it. So thank you so much. Take care. Stay safe. Bye.